The following segment is sponsored by Stubbs Dental Implant Center. Did you know that over 42 million Americans will use dentures at some point in their life? On average, people usually get their first set in their 40s, but there is a better way. So Dr. Riley Robinson is here to share a life-changing alternative. Welcome to the show, Riley.
Appreciate it. Thank you.
Well, I'm excited to hear about this life-changing opportunity. And you know, I think that dentures can be a little bit intimidating for people, right?
Yeah,
They'd be like, I'm not ready for that. But like people in their 40s, you want to have the best look, the best teeth. So tell me a little bit about dentures and what can be a problem for people if they're really thinking about maybe moving forward.
Yeah, dentures are just a struggle. I always tell people, you know, we've been doing dentures for 100 years. We really haven't made that many improvements or advances on doing dentures, so it's a really antiquated treatment option. So whenever you go straight to dentures, you lose a lot of chewing function, you lose a lot of the aesthetics and just like the speech issues that people have with it. If anybody is looking at dentures, ask somebody that has dentures. Nobody's going to tell you they love their dentures. So the good thing is now we've got plenty of other options involving dental implants where instead of replacing teeth that are failing or missing with a big piece of acrylic, we can actually place multiple implants and then place a bridge on top of there so that you have the closest thing to natural teeth.
Well, like I think it kind of goes back to what I was saying. When people think of dentures, and everybody has different genetics and different teeth, and so I think they're like, I'm not ready for dentures because of what you just said.
Yeah.
So dive in a little bit more about this alternative. What does that kind of process look like?
So this option is called All-On X, and for those people who aren't ready to feel, you know, like their grandparents that they saw wearing dentures and still want to have something that resembles and functions like natural teeth, this All-On X option is basically replacing their teeth with a new set of artificial tooth roots. So in other words, a dental implant. So the dental implants go into the bone, and then we place a bridge right on top that resembles natural teeth and functions as close to natural teeth as we can.
Man, this sounds like a really good alternative. I actually have a few people in mind. I shouldn't call her out, but my mother is someone who has some just health stuff, and she's been talking about it, but I think the denture was a little intimidating because she's not quite there yet. But this, I'm going to call him after the show. Who's a good candidate for this, though?
You know, really, our teeth weren't designed to last 100 years or 80 years like we're lasting now. So normally when folks get, you know, into their 40s, 50s, 60s, we start having a lot of teeth that are failing. You know, there's a lot of medications that people have to be on nowadays that cause dry mouth, that just cause these teeth to decay and fail. So anybody that has failing dentition and is missing teeth, that just needs a better option to, number one, look how they want to look, function how they want to function, eat the things that they want. Those are the people that are perfect candidates.
Well, the fact that there's another option I think is incredible. And what makes Stubbs such a great place? Because you want to find a place that you can trust. And I know you guys take care of your patients.
Yeah, I mean, in the state of Utah, we've placed more implants than any other provider in the state. We've won Best of State multiple times. So we really try to place the patient first, because it's not about, you know, everybody gets the same sort of treatment, everybody gets the same set of teeth. We try to individualize this to your expectations, to what you need, and I feel like that's really played a role in, number one, being providing patients with something that makes them happy, makes them feel good, makes them look good, and that has kind of snowballed into winning Best of State and kind of growing as we have.
Well, thank you so much, Dr. Robinson, for what you're doing. You're giving these people confidence. You can go to the bottom of your screen for more information. There are several locations in the Valley and outside of Utah, of course, so thanks for coming in.
Hey, thank you so much.
You bet.